So be prepared for the live interactions. So without wasting any more time, let's get started. Let's get started with case number 1. 60-year-old, why it's moving forward. 60 years old female patient presented to our hospital on 2nd September 2015 with history of acute onset severe headache on and off for the past 3 to 4 weeks. Patient was conscious, well oriented with no localizing signs at the time of admission. No history of trauma, fever, vomiting, or neck rigidity. Patient had done MR angiography 3 days prior to the admission, and they had brought these scans along with it. So let's see the scans. This is the flare sequence. What do you find on flare sequence? I think there's something wrong. I think it keeps changing. I think otherwise I'll give away the diagnosis to them otherwise. Just check. Okay. So the flare sequence, what do you hyperintensity in some left posterior parietal cortical sulci. Beside that, of course, you find some small, tiny bifrontoparietal periventral white matter, chronic ischemic foci. So what is the diagnosis on the flare sequence? What is most likely to be diagnosis? One of you please, loudly. When you find flare hyperintensity, what do you find? SH, of course. The fact is that it can be said even the basal exudate, for example, can appear hyperintense. And if you inject the contrast, if enhances, obviously it will be enhancing basal exudates. But in a story which patient presented with this severe headache on and off, I think subarachnoid hemorrhage should be the first differential diagnosis. So that's the possibility of the SH is most likely. So they went ahead and did the MR angiography also outside, and you can see over here, the intraluminal vessels appear absolutely normal. There is no obvious anomaly, any occlusion or aneurysm that you can see that. But all of us know that the MR angiography is not always foolproof, and maybe a small tiny aneurysm can be missed, and CT angiography nowadays give you much better results and all that. But the fact is that patient came to our hospital, 3 days later to the scan and all that. On admission, we repeated the scan, and that was just a pre-contrast CT, and that really confirmed that it was a subarachnoid hemorrhage, because there's a hyperdensity you can see over there, and we didn't see any, it's changing. Huh? Yeah. So now basically, if you're talking about subarachnoid hemorrhage, for example, that now we have confirmed the diagnosis of subarachnoid hemorrhage patient has. The 85% of the subarachnoid hemorrhage causes could be ruptured aneurysm. But the fact is that whenever you see a bleed in a ruptured aneurysm, the location of the bleed will determine the site of the aneurysm. I think these slides are changing.